South Carolina also hit a record today with hospitalizations. The Palmetto State reporting 1,433 patients who have either tested positive or whose conditions are under investigation. Now keep in mind, South Carolina has half the population of North Carolina. So if you look at those hospitalizations per person, it's actually much higher. The difference here is we do have specific information on our local hospitals in South Carolina. So we continue our team coverage right now with South Carolina Bureau reporter Greg Suskin. Greg, you're there in Lancaster. So what is the situation right now there?
Well, I think you used the right word a few moments ago, concern. That really is the correct word to use, I think. It's certainly much busier here than it was even a couple of months ago. Like, for example, here at MUSC Lancaster, they've now got 11 confirmed COVID-19 patients being treated here in this hospital. That is up significantly from a couple of months ago. But one thing they're also focusing on is trying to keep their staff healthy as well. COVID-19 hospitalizations are at an all-time high in South Carolina. As the numbers grow, so do concerns at the State Hospital Association. Melanie Matney is the COO there. She says staffing is the biggest issue.
Getting admissions, people who work in hospitals available and not quarantined, not sick due to community spread, getting them into the hospitals to work.
Here are the hospital bed occupancy numbers for our local counties. York County just under 87%, Chester at 50%, Lancaster under 50%, and Chesterfield near the state average at 75%. Statewide, there are more than 1,400 patients with COVID-19. That's 18% of all patients in the hospital that have COVID-19. Hospital bed use has jumped from 61% in April to 75% in July. In Lancaster, Chief Medical Officer Dr. Edward McCutcheon says they haven't relaxed any of their strict hygiene or social distancing policies for staff, and community spread of the virus in this area is a daily concern.
Healthcare providers are just as vulnerable as the general population, and I would say we're probably more at risk because we're having more potential exposure.
And as we mentioned, that 1,404 number in the story there of hospitalizations, that was from yesterday. Late this afternoon, that was updated to 1,433. That is the highest number so far. Is increased every day for the last 7 days. Back to you.
Yeah, highlighting more of that concern. Thank you, Greg. We did hear from officials today that they're also paying close attention to hospital surges in other cities, using that as guidance to prepare here. So we took a look at the states and cities across the country running short on hospital beds right now. Georgia reporting that its ICUs are 82% full. Alabama at 88% full. Some hospitals, meantime, in Central Florida reporting they are between 88 and 90% full. And in Texas, the Rio Grande Valley area reporting 10 of its 12 hospitals have already reached capacity.